Trevor, welcome back to our show. Always a pleasure to have you on. Today, we're going to be talking about HPA axis dysregulation or dysfunction. That has recently been changed over the years. It used to be called adrenal fatigue, adrenal dysfunction. But more specifically now, it's HPA axis dysfunction. So, talk about that.
Yeah, so thanks for having me, Shawn. So I guess I'll start with why this matters, because this is the fundamental root cause for the majority of hormone dysfunction. But if we work backwards from that, this concept of adrenal fatigue is we have to understand the body. So we have the hypothalamus in the brain, which is our surveillance system. We have the pituitary in the brain, which is just listening to the hypothalamus. And then it's all triggering that tiny little adrenal gland on our kidney. But the reason why it's no longer referred to as adrenal fatigue is because that would suggest that the adrenal has a decision-making ability, which it doesn't. It just does what it's told. It's a puppet. And so essentially what all of this boils down to is the brain. And the way the brain perceives stressors matters. And that is how we trigger hypothalamus, pituitary, adrenal in regard to the release of the most important portion of this topic, which is the stress hormone cortisol. And like I said earlier, why this all matters is because our sex hormones, testosterone, estrogen, and then the other side of the pathway, progesterone, all rely on healthy hormone production, starting with pregnenolone and DHEA. And so I can kind of bring this all together by sharing the chronic stress graph and how chronic stress affects our hormones. So this may look like a lot, but it's really not if we just take a moment to understand the left side here is normal, healthy levels of cortisol, pregnenolone, and DHEA. And remember, testosterone, estrogen, progesterone all come back to healthy pregnenolone use, okay? Normal is here. As we experience stress in life, cortisol, our stress hormone, spikes. And then eventually, if we continue, notice the graph says chronic stress. So over the long term, if we stay stressed, eventually all three plummet into burnout. Okay. So this is critical to understand. Cortisol spikes and plummets. Pregnenolone just slowly goes down. DHEA just slowly goes down. So if we take a moment to understand, I'm going to exit this. If we take a moment to understand why does this all matter? Well, it matters because all of our hormones are going to go down over time. It's simply put. That's why there's a need for bioidentical hormone replacement therapy. That's why there's a need for all these hormone treatments is unless there's a genetic predisposition, that summarizes the slow chronic onset of stress, fatigue, changes in estrogen, testosterone, and pregnenolone. And that's how you can also unwind this whole thing is understanding what caused it. And then now let's work on the root cause. So as we work to the root cause, I'm going to present one more thing, which is the understanding of what is a stressor if we had to define a stressor. So this is the easiest cookie cutter, simplistic way of defining stress as a biological stressor, not stress as in I feel stress. And that's mental emotional stress, sleep stress, inflammation or inflammatory stress, and blood sugar stress. That is it. Those are the four stressors. So all four of those cause dysregulation in your hormone system. Again, blood sugar, so drinking soda every day. Inflammation, eating a high inflammatory diet every day. Sleep, not sleeping well, quality or quantity. And then mental emotional, that's the one we all think of when we hear stress. So I want to make that abundantly clear that as I unshare this, four key stressors drive this whole equation. And over time, our hormones get depleted. And so the way we unwind that is we address the four key stressors, manage your blood sugar, manage your inflammation, manage your mental emotional stress, manage your sleep. And we can use formulas like Adrenal and Adapten-All to modulate the cortisol response. So what are Adrenal and Adapten-All? They're adaptogens that manage the way our body perceives stress. Adrenal addresses that stage 1 spike by lowering the cortisol response. It's calming. And then Adapten-All is adaptogens plus licorice root, which elevates cortisol because it's burnt out and fatigued and exhausted. And so we're just trying to modulate. So the way you should feel is stage 1, you're stressed and wired. Can't sleep, you're up all night, your brain is wired, you have anxiety. These are the types of symptoms of a stage 1 stress patient. And you use Adrenovive. And then on the back end of that, as we continue, eventually the body dysregulates and shuts itself down. And that's now burnout. That's stressed and tired. That's exhaustion. That's I don't want to get up. I'm unmotivated, depression, etc. And that's now Adapten-All to elevate that response and kind of kickstart you out of that funk. So I know it's a lot. It's possibly one of the more dynamic topics in medicine and one of the harder ones to kind of boil down and treat. It's certainly evolving. But if we can understand what is chronic stress, what are the 4 key stressors, and then what are the solutions, and then from a supplement perspective, how can we supplement those solutions with adaptogens, I think we're on a great track.
Well, thank you for that. That was a great presentation. One thing I like to remember, it is difficult sometimes when we look at it, although to treat HPA axis dysfunction. But when you look at it, sleep, diet, those are all things that we can control. And sleep, I think, trumps a lot of that.
Absolutely.
And also, here's the thing. It's really important because if you don't have your HPA axis regulated, so your cortisol is not being produced appropriately in response to stress, then nothing else will get better. So
Amen.
that is very important to fix that first.
Right. And I think that's well understood in this whole fight or flight response, right? Where if we're in a state of stress, the body is not focused on fertility. The body's not focused on muscle anabolism. The body's not focused on any of these things. The body will always prioritize survival, right? And so stress equals the body shifting long-term health, longevity, and anti-cancer activity, and all these things for your blood pressure is off today, and I need you to stay alive. So deal with blood sugar and blood pressure now. So yeah, I couldn't agree more that if you don't manage the stress system, your body will never have longevity.
That's right. That's right. All right. Thank you. Thank you, as always, Trevor.
Thanks, Shawn.